has been a reminder of so many of the health and wellness challenges that many of us have already seen in our families and our communities. When we talk about comorbidities, these were things that existed before COVID-19. These were things that were already going to adversely impact our lifespan and our ability to spend time with our families and live our very best lives. Now, as we see hope on the horizon with this vaccine, and we are beginning to roll it out, not only do we need to ensure that it is administered as safely and as efficiently as possible, but hearkening back to the divisions that we have, there is a division and a dearth of confidence in our institutions, some of it rightly so, and in some of our science. We need to come together to educate and empower our community to not only save lives, but save our future. So tonight, as we are on the precipice of coming back from one of our darkest hours to beginning to write the best chapter in our future, let us come together. And I want to thank each and every one of you for doing what you're doing to not only empower others about the vaccine, but also empower others to live their very best lives. Thank you again, and have a blessed evening.
Thank you, County Executive. So a few logistics before we start, and thank you again, County Executive. All participants will be on mute to ensure everyone can hear our speakers. We have over 1,100 people registered for tonight's forum, so we do hope Zoom is kind to us. We are also recording tonight's forum, and it will be posted on the Horizon Foundation's YouTube channel so that all residents who are unable to attend can learn from our experts. And while this forum will be in English, translation is available for non-English speakers on our YouTube channel as well. We will also be live streaming the event on Facebook. So lots of ways to connect with us if you're able. Thank you to so many of you who submitted your questions in advance. We will be posing your questions throughout the evening to our speakers. We'll try to get as many questions in as possible, but please know we're not going to be able to answer all of them, either because we don't have enough time or because we're still getting guidance from the state and federal government, particularly related to vaccine distribution. So again, I would say if you follow us on social media, then we will be able to get more information out to you after this forum. In order to minimize distractions, we have not opened up the chat feature for this event, but if you do have questions during the evening, please submit them to info@thehorizonfoundation.org, and we'll get back to you in a timely manner. Again, for more information, follow us on social media, bookmark the county's Stay COVID Safe website, be in touch, and again, please be patient. We'll get back to you. So I'm going to moderate the first discussion on vaccine development with Dr. Ruth Karen, Professor and Director of the Johns Hopkins Vaccine Initiative at Johns Hopkins Bloomberg School of Public Health, and an expert in vaccine development and vaccine safety. And Dr. Freeman Hrabowski, President of the University of Maryland, Baltimore County, and a participant in the Moderna COVID-19 clinical trial. Afterwards, Dr. Mohammed Shafiq Ahmed, Interim President of Howard County General Hospital, a member of Johns Hopkins Medicine, will have a conversation with Dr. Maura Rossman, our Howard County Health Officer, and they're going to talk about vaccine distribution, which I know is top of mind for many of us. Our goal tonight is to discuss the opportunities, benefits, and challenges associated with the COVID-19 vaccines currently approved or under development, and to discuss, again, vaccine distribution plans in Howard County and Maryland. We will have a particular focus on how communities of color have historically and presently experienced health injustices, and discuss ways to address racial equity in decisions related to the vaccine, its distribution, and community decision-making. So I want to welcome Dr. Karen and Dr. Hrabowski.
Thank you.
Good evening. Dr. Karen, my first question is for you. Operation Warp Speed seems to imply that maybe we've cut some corners in order to get the vaccine out as fast as possible. So can you address Operation Warp Speed, the federal government review process for vaccines, and whether we've cut any corners to get these vaccines ready for distribution so quickly?
Well, thank you so much for that question, Nikki. And what I have to say is that despite the name, we have moved, as a country, we have moved quickly, but always with safety in mind and with the best science in mind. These studies were really a triumph of science in many, many ways. It was vaccine developers at the NIH and an industry working hand in hand. It was our vaccine evaluation units all over the country. And it was the thousands and thousands of volunteers who quite literally rolled up their sleeves to participate in these studies. There's a lot of data that was used to make decisions about these vaccines. There were 30,000 people in the Moderna trial, about 30,000. There were about 45,000 in the Pfizer BioNTech trials. The FDA was very clear about the requirements for emergency use authorization, and both companies exceeded those requirements. And all of those deliberations, by the way, were public. So it was broadcast to the American people, the discussions of the FDA and its advisory committee. So no corners were cut. This is just a triumph of effort on many fronts.
So then how is the science? Are both the vaccines that have been approved to date safe and effective?
Yes, I'm going to talk first about the efficacy, because for those of us who work in the vaccine world, this is a home run. This is absolutely a home run. These vaccines are, in these trials, were 100% effective against serious disease, hospitalization, and death. And they were 94 to 95% effective against any COVID disease. And for a vaccine, that is just as good as it gets. It's really quite remarkable. In terms of safety, these are vaccines that do cause reactions when you first get them. One of the things that we compare it to, for people who are familiar with this, is the shingles vaccine. So it is true that people often have sore arms. They may feel achy. Some people may have fevers and be exhausted. So there might be a period of 24 to 36 hours where people really aren't feeling very well. But we think this is a reasonable price to pay for vaccines of that great efficacy. I will say something about allergic reactions just quickly. The estimate for the Pfizer vaccine is that we've seen severe allergic reactions, what we call anaphylaxis, in about 11 individuals per million people vaccinated. It seems a bit lower for Moderna, but somewhere probably around that range. I would say that everyone who administers vaccines, this kind of severe allergic reaction is very rare, but it's a known complication of vaccine administration, and everybody who gives vaccines is prepared for this. They have medicines available if there is an allergic reaction. But so yes, in general, these vaccines are safe and they are highly effective.
Thank you. And I appreciate the information on side effects and also the allergic reactions. And I know Dr. Rossman will also address this later as we talk about getting vaccines in arms here in Howard County. So we've been hearing a lot about the messenger RNA technology that's been used to develop COVID-19, Dr. Karen. So it seems a little concerning, right? We've got a new technology for a novel disease. Maybe it's too many news for me. But can you comment on the new technology and your thoughts?
Yes, absolutely. So the first thing I would say is that while we don't have, these are the first vaccines we have approved for use that are messenger RNA vaccines. This technology was not invented in January. These mRNA vaccines have been worked on by scientists at companies for over a decade. And there have been small scale trials, nothing like the size of these trials, but small trials of vaccines against other diseases. So it's not new technology in 2020. The other thing though, just to say is something quickly about how these work. What happens is that this is a messenger RNA that goes into cells and tells the cells how to make the coronavirus spike protein. And that's important because it's that protein, antibodies to that protein are what's protective against coronavirus disease. So it's basically your cells are turning into the factory. One important thing to say is that this doesn't go where your genes are. It doesn't go into the cell nucleus. It doesn't alter your DNA. It doesn't engage with your DNA at all, because I know when people hear a genetic vaccine or RNA or nucleic acid, they worry about that, but this does not get into your genetic material at all.
That's really helpful. I know we've had a lot of questions about that submitted from our residents beforehand. So Dr. Hrabowski, I'd love to bring you into this conversation. You chose to participate in the Moderna clinical trial despite the long and present history of medical harm in the United States, particularly related to people of color. I'm of course thinking of the Tuskegee syphilis experiment, the legacy of Henrietta Lacks that's a little closer to home. And I also know that, some of the distrust is deeply rooted in slavery, Jim Crow, current day police brutality, and the disproportionate impact that COVID-19 has had on the African-American community and other communities of color. So I'm just really curious, all this history, give me your kind of personal reason for participating in the clinical trial.
Sure. I am very fortunate that we at UMBC produce a lot of scientists. Let's start there. And these scientists are working at Hopkins, at NIH, and other places. And it just so happens that one of our graduates is the lead scientist, Dr. Kizzmekia Corbett, on the development of the vaccine with Moderna, but her technology is actually in other vaccines, including Pfizer. And she and I text a lot. It's amazing. She's a young woman. She's 34, came to us from rural North Carolina, came at 17 to UMBC, went on, graduated, went back to Chapel Hill and earned a PhD, then postdoc at NIH, and has been leading this team for some time. And she's been telling me about the work, the excitement. And what's amazing is that she also understands sociocultural issues that are affiliated with this challenge. She had an undergrad major in biology and sociology, and it's interesting. So she's very attuned to the challenges when thinking about vaccines and people of color and people who may not know science or trust science in general, and had said to me months ago, back in the summer, that they were really looking for more people of color, and specifically African-Americans. They wanted the Latino population and others, but that they were having the hardest time with Blacks, with African-Americans, for understandable reasons. And so when she said this, my wife and I talked about it, and Jackie and I decided we would be in the study, because I think it's important for leaders to step up, particularly when we understand the importance of expertise and science and trusting the science. And for those of us who are fortunate enough to know enough scientists of all races, we know that in general, people care about people. While there are still challenges sometimes in certain communities, let's be honest, when doctors are not showing young Blacks and black families and people of color the kind of respect. The fact is that most people really do care. But most important, we thought if we could show that it was okay for us, it would encourage other people to get involved. And it's been that way as we've been talking with friends and a lot of people since September, in fact. Yeah, that's our reasoning.
Well, I appreciate the leadership you and your wife have shown, and I know many in our community do as well. You started talking about this, but do you feel enough people of color were represented in the vaccine development process? And maybe to give you a softball here, right? I know you're a university president, you're passionate about education and math and sciences,
Sure.
but how do we continue to build this diverse representation in
a great
our students moving forward?
There's several things I would say. First of all, I remember the night when Kismikia wrote me, Dr. Corbett texted me and said, we've got the 13%. With African Americans are 13% of the American population. This is in the Moderna, and they actually were able to get to that number. And so there is a great deal of interest in making sure we have taken into account these different groups. And we were working with, we're very respectful of what's happening over at Hopkins, Dr. Karen, and we were working with University of Maryland Center for Vaccine Development. And what I could say to people as they were going in to take, they were thinking about it, is that when you go into that center, you see people of all races, men and women, healthcare workers, and you feel that sense of trust, which is also important. The point about representation, though, if you think about it, fewer than 2% of the scientists in the national agencies in this country are Black, fewer than 2%, and many of the agencies under 1%. And so what we've been doing at UMBC is working to produce more scientists of all races. We're now the lead producer of African Americans who go on to get MD, PhDs. And we're right there at the top, along with Howard, in producing PhDs in science. Now, why is that important? People need to see people like themselves who are involved in the process. And so when I say, well, I've got a graduate who's Black, who is at the leading line for developing this vaccine, and they go, yeah, right. And when I say she's Black, you know, I have to show them the picture. I have to say, go to see it. They Google her name. You'll see she's African American. She's on CNN with Cooper Anderson, right? And they are in a daze. They're in a daze because that's the challenge we face when thinking about structural racism. We as a country haven't even thought about many women creating vaccines in general, and we certainly have not thought about Black women creating vaccines. So you start there, and the point is, when little girls of all races see Dr. Corbett, it says to them, I could do that one day. That's what's so significant. And when I'm talking to CEOs, I'm telling them, when they take that vaccine, I want them to see the face of that Black woman having created the vaccine. Just, it changes attitudes, you see? And so we need to be helping our children to understand they can use their expertise, their brain power to learn science and become doctors and scientists and help us with all the future challenges that we'll be facing.
Another reason why this vaccine development has been unprecedented, and hopefully we're learning a lot from it, right? And it's going to continue. We're going to have lots of people of color in the future.
And we've got great students from Howard County who are becoming scientists. I want to say that. Great
Absolutely. So, Dr. Rabatsky, what would you say to African Americans, other communities of color, the Latinx, Asian Americans, who may be still contemplating whether or not to get the vaccine?
You know, people, the first thing people say is, well, yeah, but Freeman, but you are advantaged, you're a college president. But I grew up in Birmingham, and all of my life, I saw those grotesque photos of the Tuskegee experiment. I saw what syphilis looks like. It was disgusting. It was frightening. And we could count the number of Black doctors. There were only 1 or 2 in our community. So we didn't see many even. So I understand that. I know that I was born in the basement of a hospital and I was considered privileged. This is the history that we've all gone through. And yet what I would say to them is this: we are dying, Blacks, people of color, in disproportionately large numbers in terms of this disease for many reasons, including conditions we had before this started, including the kinds of jobs that we have, sometimes the first line workers. And the question becomes, if we don't do this, then what? That's what we have to get. And what I'm saying, and what my students are talking to me about, is that even if you have COVID and you don't have many symptoms, you still can spread it to people who may have a terrible reaction to it. So we are telling people they should take this vaccine, not just for themselves, but for their parents and grandparents, for their assemblies and other people they're around. This is about community. It really is. And about the public good. So it's about being selfless. And this is, I'm saying that to people more and more. Those to whom much is given, much is required. We have a responsibility to all of the people around us, not just for ourselves. And the other part, they say, well, you've got 1 Black there, but that doesn't mean on the manufacturing side of Moderna. People have an answer for all of this, right? Well, I can even say that Darian Cash, Dr. Darian Cash, is another Miles scholar, young Black man, UMBC, PhD and postdoc from UCLA, who's a lead scientist, a senior scientist at Moderna, African American. So to be able to show Blacks involved in the process from the development to the implementation, and then in the healthcare workers can begin to give people a sense that we can trust this process. And then as they see leaders taking the vaccine, and my wife and I are convinced we got it. You know, with the study, it's placebo for half and then the other half. And we're getting the unblinding visit, Dr. Karen, next week, when we'll find out whether we really got the vaccine. But we are convinced we got it because we had sore arms. And for almost 2 days, we were really tired. We normally work out a lot. We could not work out. We were very tired, and we were very glad because we thought it meant we must have gotten that vaccine. So wish us luck. We'll know next week. And the good news for those who get into studies, if we didn't get it within a short period, we'll be able to get it. That's one of the advantages, that we will be able to get it. So, but the impact that you're tired, we found, and a sore arm, but it was not bad. And given the positive side of all of that and what it's protecting against, it was well worth it. That's the point we're making to people.
Yeah, I would underscore it's about community and it's about family, right?
Yeah.
It's about thinking about what we really missed from before COVID. I miss my parents
Yes.
and the ability to see them again.
Yeah.
So.
And the other point I would make is that given the emphasis in our country in recent years on getting away from science, on not respecting the science and expertise, those of us who know better will need to do even more in being proactive about talking about the importance of science, of medicine, of expertise, of listening to what experts say. And I'll put another side, and the importance of the humanities and the arts in the ethical implications of all of this. We have to be able to talk about the ethics of all of this. So we will need people educated in all these areas as we think about the challenges of the future, because we would be naive to think this is the last crisis we will face. You know, we just know others will come up, and we need as many people prepared, not only in science, but also with ethical considerations and in the humanities and other areas, to put all of this in perspective.
Thank you for that. Dr. Karen, anything that you would add regarding, again, enough people of color that are sufficiently included in the clinical trials and in the FDA approval process?
So I can't be nearly as eloquent as Dr. Hrabowski, but I just like to say a couple of things about this. You know, a lot of people ask me, after COVID, what will change about vaccines and how we evaluate vaccines? And I have to tell you, this is a watershed moment. Our insistence as a community that we have to include people of color in our trials, we will never go back. I mean, this will become the standard, and this is a really important legacy, I think a critical legacy. The other thing that I just wanted to say is something about health equity. So there are structural injustices across our country in health as in everything else. We have to work on all of those injustices. But giving vaccine, and particularly getting vaccine out to communities of color that are at higher risk of severe COVID disease, is one step in beginning to address health equity.
I think that's such an important point.
Yeah.
When people talk about how do we address all the challenges that we've been discussing for months in our society involving structural racism, the health aspect is so critical. And let me just give you a sense of how far I think we've come. My colleagues and I were working on an article involving science and representation and COVID in the spring. And when we started, perhaps in March in that area, we wanted to understand the data by race. And we were being told it had not even been disaggregated. The people had not thought to disaggregate the data until to understand what's happening to different populations. And the comment was made, oh, do you think COVID is racist? Well, they missed the whole point. That no, this is about a larger context of structural racism. And what happens is the COVID sheds light on disparities, as Dr. Karen said, that already existed, quite frankly, whether it's in the kinds of jobs people have, in their health conditions, in our attitudes about it, in our level of trust or lack of trust. And so this is a moment where we are seeing who we are as a society. We saw that yesterday, and I mean that in the best and in the most challenging, both. Yeah. Many of us were so encouraged by the way people had the chance to vote in Georgia, to vote and speak their truth. And then we saw what happened in the evening. quite frankly, and we were just saddened. And then we saw our elected officials come together to say, but we're better than this, and that we must get through this process. Well, the same thing is true with COVID. I bring that other situation up because it is the worst of things that we've seen recently, but we have this opportunity as leaders and as people who are privileged to say, we're better than this. We will make sure, as Dr. Karen said, that people who have not had access to healthcare are taken care of during this process. So this is a time when the light is shining on all of us as a society.
We are better than this.
Yes.
Yeah. So we got a lot of questions submitted about underlying health conditions, those that particularly affect people of color that we've talked about, diabetes, heart disease, asthma, sickle cell. We've also gotten questions about, again, so was the vaccine safety and effectiveness measured against the underlying conditions that people have? Dr. Karen, would you like to kind of take that one?
Sure. And I would say that, you know, these vaccine trials were different in many ways from vaccine trials that have come before. And very often prior to this, when people did vaccine trials, they would exclude people with underlying conditions. They would be studies in the healthiest of the healthy. That was not true in these trials. In fact, there were special efforts made specifically to include people with underlying conditions. And the analyses, which, by the way, for your viewers, we can make this available. These are all publicly available on the FDA website. So the entire analysis of the Pfizer and of the Moderna vaccines of their efficacy is available. And it is stratified, separated by people with underlying conditions, because they did enroll enough of these individuals to be able to look and say, is the vaccine also safe and effective for them?
You know, I have an anecdote. I've been doing interviews with my wife with different people about our participation. There's a campaign, the governor's massive vaccine campaign, and they interviewed us. And I said that Jackie and I are of a generation that is not necessarily reality TV oriented. We don't just say everything that happens. My son and their generation will put things on Facebook in a heartbeat, right? And I'm not judging, it's just different. We're more private. But I decided to sound like reality TV when I tell this story. We went to get the examination first at the Center for Vaccine Development, where they do a great job. And my wife went right through, Jackie went right through, and before you know it, she was getting the injection. Well, they took my pressure and it was high. I know I have high blood pressure, and I actually have medication that I've taken for years. And they said, well, let's give it a while. And we'll say, well, we went through about 2 hours and it would not come down. In fact, the more there were cameras there, and the more often they took, the more it was going up. As much as I was laughing and trying to be the calm, collected president, it was not helping, right? And finally, I was so impressed by them. They said, you know, we really would love to have you in this study, but we need to understand your underlying condition, what it is first. And we can either get you to our doctor or you can go to your doctor first. And let's see what he says. And I did go, and my doctor knows me well. And by the way, my doctor is African-American there at the University of Maryland. And he made me laugh so that it did begin to come down some, but he gave me another medication and told me to wait a week or so. And my pressure is fine now, but I tell you that because I went back and then I was able to get into the trial. And I say that because there are two things. One, they do want people with all the conditions, but they also want to make sure you're in the shape that your doctor would want you in. They want to make sure, of course, that, and I was just at the point my pressure was much too high. But I say that because a lot of Black people have blood pressure problems. You know that. It's genetic with mine. My parents had it. And I'm under a lot of stress, all those things. So I'm being reality TV here and saying, oh, man. And even when you can laugh and seem like you're on top of it, your pressure can say something else. So, but they were very sensitive to all of that. And so there are people in the study who, as she said, as Dr. Karen said, have underlying conditions.
I appreciate the science and the stories.
Yeah.
Yeah. So Dr. Karen, what about, we had a couple of questions about folks with autoimmune issues, cancer. Do you want to talk about any of that? And again, whether they were in the study, and then I guess, again, concerns about whether they should take the vaccine.
Yes, and for for people with those conditions, they, for the most part, were not enrolled in the trial. And I think they need to speak to their physicians about that. I think that's the best advice. And I think for a couple of reasons, you know, safety is one thing, but one of the things we also are concerned about is whether people who either have an autoimmune disorder or cancer, who may be on medications that will suppress their immune response, whether they will have a good enough response to the vaccine, because there may be alternatives for them at some point. And I think it's really something for them to discuss with their doctors.
So maybe we
just
can,
in support of
go
that,
ahead.
I've talked with several friends. It's so funny. People call me Dr. Balsky. I'm a mathematician. I'm not a physician. But when they call me, the first thing I always say is get to your physician and see what they say. I did find it very comforting, though, that at the Centers for Vaccine Development, people, they want to see your medications. You have to bring in everything that you're taking right now so that they can discuss it with you and make sure they're being as individualistic in understanding those issues, which I think is critical. Absolutely.
Critical. So let's talk a little bit about maybe other populations that weren't included in the trials, specifically pregnant women and children. Dr. Karen, can you comment on when pregnant women and children may be able to get vaccinated too?
Well, pregnant women can get vaccinated now. I will be honest and say I think it's unfortunate that we haven't yet directly evaluated these vaccines in pregnant women. This is a particular interest of mine and something that I and many others have been advocating for a long time, that we evaluate these vaccines in pregnant women, particularly because we know that pregnant women are at increased risk of severe disease with COVID, and because so much of our healthcare workforce are women of childbearing potential, and many of those women are pregnant. So the American College of Obstetrics and Gynecology, ACOG, has said that this should be, that pregnant women, particularly pregnant women who are healthcare workers, should consider receiving these vaccines and should discuss it again with their physicians. There will be direct evaluations, is my understanding, this year, 2021, trials in pregnant women. But in the meantime, particularly for women who are on the front lines, whether they're frontline workers, who are healthcare workers or other kinds of workers, they may want to consider use of these vaccines. As far as children are concerned, it probably depends on your definition of a child, because the Pfizer vaccine can be used in individuals 16 and above. So there are some children. These trials are, Pfizer is actually conducting trials now in ever younger individuals, and Moderna will likely follow suit. So we will have information that will allow us to think about vaccine in children probably a bit later this year.
Okay, and that's extremely helpful. Thank you. So how long does the immunity last? Do we know how often we'll have to take the vaccine? And can you talk a little bit about what we know about longer term effects?
Right. So what I would say is that the Pfizer and Moderna vaccine trials started in July. So the longest, you know, we don't have information that goes much beyond about 6 months of protection. That's at the outside. And then we have many individuals who are immunized after that. So we don't know how long the protection will last. You know, COVID is really unique in many ways, but it is a respiratory virus. And, you know, that's something that I worked on for a long time before COVID. And if COVID is anything like other respiratory viruses, we think it's pretty likely that the immunity against severe disease will be probably pretty long lasting. It may mean we may want to offer boosters in the future to help protect against any COVID disease. I think time will tell. I think we just don't have the data yet to be able to say. But I think given the level of immunity that we've seen, at least with these first 2 vaccines, I think it's likely that we will have longer lasting protection against severe disease. In terms of other long-term issues, one of the things I wanted to mention is that we have systems in this country for following vaccine safety. Those existed before COVID, and we have a system that is COVID specific. It's called Be Safe. It's run by the CDC, and it is an app-based platform that allows people to report what we call adverse events, issues that they think could possibly be related to vaccine. It doesn't necessarily mean they are, so that we are able to track long-term what happens. The other thing just to mention is that Dr. Rabowski and others who are in trials, they're not done yet.
Right.
Right. I mean, we are using these vaccines, but they are going to be followed up long-term.
Yes.
To look for adverse events. And even, these are the people who got vaccinated. These are the people who are getting crossed over now from placebo to vaccine. So we will have that information from the trials, and we will have that information from Be Safe.
Just to piggyback on what she said, Jack and I are in contact with the center every week. We get the notification. We have to fill out, answer the questions. We understood from the beginning that this was at least 2 years, and we'll see beyond that. But and I think what people should think about is this is all for the public good. This is to help our children's children. I mean, we're learning things now that will be helpful for generations. We're setting some foundation there for the next generation. So I think it's a great opportunity to think about building community and doing this for more than just ourselves. And the other point I would make is the need for patience. I mean, what Dr. Karen is saying is we will be learning along the way, and we'll make adjustments as necessary. And I think the key is to remain as safe as possible. There are 2 injections you get a month apart. But the fact is that it will be months and months before a lot of people get it. And so from my perspective, the longer we're wearing masks and washing our hands and being socially distanced, the better off we are. We shouldn't just get confident right now. We're learning from this process. And quite frankly, in COVID in general, we're all learning that maybe things can't happen so quickly. We need to take our time, be a little more patient, and follow the experts, follow the science. Of all the things I can say, follow the science. And for people in the Howard County area, and get your kids to think about aspiring to be a Dr. Kizzmekia Corbett of creating a vaccine.
Absolutely. So Dr. Karen, I have one last question before we move to the second panel. If I get the vaccine, can I still asymptomatically transmit the disease?
Right. So I was just going to follow on what Dr. Rabowski was saying.
Yeah.
Perfect segue, actually. The answer is that when we evaluated these vaccines, we looked to see whether these vaccines could prevent disease in the people who got them. And that's a different question than, can I be infected and feel fine and be fine, but transmit to my child, my neighbor, the grocery store clerk? And the answer to that question is we don't know. We honestly don't know. It's possible that vaccination will help prevent that transmission, but we don't have any data now. So the answer, the short and simple answer is you get vaccinated, you keep wearing your mask, you keep socially distant, you keep doing all the things that you have been doing all along to protect your community.
Well, it's about community, it's about family, and I think we've said this a few times tonight. It's a watershed event for many of us that we have lived through and that we will at some point get on the other side of. So I
Nikki,
greatly,
just one comment to
absolutely,
people that I
please.
think is important. As we get the vaccine, I think we have a responsibility to be ambassadors for the vaccine. It's not just to get it and say, okay, I'm taken care of, because so many people of all backgrounds aren't trusting right now, and we can help them. Those of us who believe in science and who believe in this vaccine have a responsibility to help other people get to that point, to know that this is the right thing to do.
Thank you. Dr. Karen, any other words of wisdom and from you?
Just that I think what we've accomplished in this year is remarkable. And I think we should be, you know, there are things we're not so proud of in our country. I think we should be very proud of developing these vaccines, of all of the people like Dr. Corbett, like scientists at Moderna, like our, and I hadn't said it, but our vaccine center at Hopkins has evaluated the Pfizer and the AstraZeneca vaccine. So all of these people, this was, you know, this was an effort of thousands and thousands and thousands of people. And I think, but the best vaccine, and this is what we're going to talk about, you know, in the next hour, the best vaccine doesn't work if it's not administered. So we've done the hard work of developing these vaccines. Now we've got to get them out.
Well, I just want to thank both of you for your time tonight, for your expertise, for your experience, for your courage, and for continuing to be ambassadors for the science and for the experience of being part of a trial. And as we will get into ensuring that most of our community can be vaccinated so we can get back to family and community and all the things that we loved before the vaccine, before COVID hit. So Dr. Ruth Karen, thank you very much. Dr. Freeman-Hrabowski, thank you very, very much.
Great. Thank you.
Yeah.
Keep hope alive. Keep hope alive.
So now I am going to turn over the mic to Dr. Ahmed from Howard County General Hospital. And he will facilitate the conversation for the next part of our discussion tonight. And again, I just wanted to remind you, if you do have questions during the forum, please do email us at info@thehorizonfoundation.org, and we will get back to you as soon as possible. Dr. Ahmed.
Great, thank you very much, Nikki. And thank you to Dr. Karen and Dr. Hrabowski. It's amazing to be in a community where we have this level of expertise to address issues when we have an issue like COVID, when we have a massive pandemic. So it's really amazing that we have that. But at this time, I wanted to pivot a little bit in our program, and we are going to move away from the science of vaccine development to the massive logistical and human challenge of actually distributing the vaccine and having our residents decide to take the vaccine and learn more about it. So we know there are a number of ethical and logistical questions about how to prioritize who actually gets the vaccine, and then how to actually get the vaccine into someone's arm, and then how to engage our communities of color and people that may have skepticism around this. So I know that we've touched upon this already. I'm honored to have a conversation tonight with Howard County Health Officer, Dr. Maura Rossman, who I know well and partner with on a number of initiatives, including the beginning of the COVID pandemic. So it's a great honor of mine. And I want to personally thank Dr. Rossman and her entire team at the Howard County Health Department for their tireless work over the past 9 months to help us with testing, contact tracing, and vaccine deployment. Thank you for your public service. And just a reminder to our audience, if you have questions during tonight's event, please email info@thehorizonfoundation.org and the staff will get back to you. So Dr. Rossman, I'm going to go ahead and start with our first question. And we know that the vaccine prioritization is based on guidance coming from the CDC and the state. We also know that guidance is constantly changing. The governor held a press conference on Tuesday and provided some additional guidance to local authorities. So for now, can you explain who is in the first category of people to get the vaccine, the so-called 1A group, and how distribution for these particular residents is occurring in Howard County?
Well, first I want to say good evening. Good to see you, Shafiq or Dr. Ahmed. Yes, we are good friends, and thank you to Horizon Foundation. And we have a tough act to follow from the first panelists. So yes, so because vaccine, I think the prior panelists did a fantastic job at describing truly the amazing process of warp speed, bringing 2 vaccines to market within a year, both vaccines safe and highly effective. We will reflect back, years later at what happened this past year with vaccine development, because it's really remarkable. Unfortunately, or fortunately, whatever way you look at it, we don't have sufficient vaccine right now to vaccinate everyone who wants it and everyone who public health officials like myself believe should get it, which is almost everyone. So we're in a position right now where we have to prioritize certain groups because we have insufficient supply. The hope is over time that we will have more and more vaccine when it will be available for whomever, whenever, wherever they can get it, similar to how I think it was Dr. Hrabowski talked about his shingles vaccine. You can pretty much get your shingles vaccine when you're eligible by age at your doctor's office or even CVS. That's the hope. And when that happens, sort of my job is done here. Until that time, unfortunately, there are the CDC, or the Advisory Committee on Immunization Practices, has developed prioritization of groups who should get it first. The states are allowed to tweak that list based on their population. And Governor Hogan and the Department of Health have tweaked it a little. So we are currently in the state of Maryland in priority group 1A. That is the very tip of the iceberg. And at this point, we are vaccinating first responders, EMS, police, healthcare workers, I'll go back to that, and nursing home staff and residents. The state has elected to vaccinate these groups using different strategies. So healthcare workers who are employed by hospitals like Dr. Ahmed will get vaccinated by his employer, Johns Hopkins. Healthcare workers who are in private practice or not employed by a hospital will get vaccinated by local health departments like Howard County Health Department. Residents and staff of nursing homes will be vaccinated by contracted pharmacies in Maryland. It is CVS and Walgreens. So this is a divide and conquer strategy, because quite frankly, if we left it to just one group, I don't think we would get to it as fast as if we have three people doing it, and hopefully get to the end of 1A. When enough people in that group have been vaccinated who want it, then we'll move to the next priority group.
Right, and I think, as a rollout goes, as the Johns Hopkins Health System, what we've done for our healthcare workers is we also had some subdivisions within our own groups. So since the past 3 weeks or so, when we've actually had the vaccinations available, we prioritize the healthcare workers, and that is doctors, nurses, could be an environmental services worker, or unit secretary, anybody that's in a COVID unit were the first people to get the vaccinations. And then after that, we moved on to people that were in the hospital, not necessarily dealing with COVID, other clinicians. And then after that, we moved towards people who are not in hospital settings, but part of the healthcare system in outpatient clinical settings. So we had used randomized lotteries to get this process done. The good news is that over the past few weeks, the entire health system has worked on getting all of these groups either vaccinated or set a date for getting a vaccination. And we've been distributing these as well. So it's encouraging to know it is a divide and conquer strategy. And we're working on some of the pieces that we have as hospitals in conjunction then with the health department. So moving on beyond 1A, for phase 1B of vaccine prioritization, how would this distribution work? I believe that this is going to also include people in assisted living and other congregate settings, adults that are 75 and older, and educators. Do you have a sense of when this phase might occur, and how are we going to notify residents that are in these categories?
Yeah, so I'm going to step back a little bit because you brought up some things that I didn't mention before, sub-tiering, right? So how these phases or priority groups were thought about is who's at most risk, and who do we need to keep going by exposure risk, and also the risk of morbidity or getting sick and dying. So hence, when you think about 1A and the groups in that, our first responders and our healthcare workers, we really need them to keep us all alive as they have been for the past 10 months. As we move into 1B, I believe the thought was, well, who's really getting sick and who's dying? So in 1B, you will see assisted living. Now, nursing home, unfortunately, we have seen, and many of us have been affected by family and friends and staff who work in long-term care facilities who have gotten sick and died of putting them in 1A. Assisted living is 1B. And the reason for that high risk of nursing homes and assisted livings is those residing in these facilities tend to be older. They tend to have comorbidities that Dr. Harbowski talked about, and so are at greater risk. And they also, it's considered congregant facility, so they're all living together, which just makes transmission much easier for a virus like this. So as we move down 1B, adults 75 and older will be in this group, again, because we know from looking at our data that older persons are at risk for death greater than younger. So we want to vaccinate our older family and friends. The last category I'll talk about in 1B is our educators and childcare workers. We know that education has been greatly disrupted by COVID-19. We've all learned to Zoom meet and Zoom learn, such as we're doing right now. And in many ways, certainly I think we've all benefited from technology. But I think we are also learning and understanding that particularly our young people, the lack of socialization, of not being around your friends and other people has had a negative impact on their emotional well-being and mental health. So I assume that is why the governor and the Maryland Department of Health have elected to move educators into category 1B.
Okay. So how will, or where rather, would these vaccinations then take place, do you think?
So I'll go back to the divide and conquer. So if you are a healthcare worker who is employed by one of the many hospitals across Maryland or our one great hospital in Howard County, you will be vaccinated through your hospital system. And I'm assuming that typically takes place on the hospital or in the hospital campus. If you are an employee of a nursing home, then you will be vaccinated on site where you work. And obviously the residents of the nursing home will be vaccinated where they live. If you are a first responder or a healthcare worker, a licensed or certified healthcare worker, you may be vaccinated at the local health department of either where you live, your place of residence in Maryland, or where you work. So in Howard County, if you are a radiology technician, a licensed or certified radiology technician, and you live in Howard County, you would be vaccinated by Howard County. If you work for a radiology practice in Howard County but live in Baltimore County, you have your choice. Go where it is best for you and most convenient for you.
Great, thanks. So again, going back to prioritization, one of the residents asked, it would be helpful to know the past and current demographics of patients by race, ethnicity, and age, and who are hospitalized because of COVID-19. It would seem that the groups with the highest hospitalizations and death rates should be vaccinated first. Is this actually the case? And then who makes the decision?
Yeah, so if you look at, and this is Howard County data, if you look at the cases of who has gotten COVID, the data is a little dirty. because the race data there's a lot of people, a pretty significant amount where we don't have information on what race they are. So that's a little messy. Our death data is a little clearer. And it is clear that Blacks are disproportionately represented in our death data compared to whites. If you look at death data by age, older Howard County residents are very disproportionately affected. So more than 84% or 84% of our deaths are attributed to individuals over the age of 65. And we know that many of a very large percentage of the fatalities also have comorbid conditions. So the older you are, the comorbidity, and if you are a Black Howard County resident, your risk is higher. And I think if you look at the prioritization of 1A, it includes nursing homes, because we know that was a very high risk setting. We know that many residents of nursing homes have comorbidities. And we know that residents of nursing homes are also among the older residents. And as you move into 1B, you also see over the age of 75 represented, regardless of your health condition.
You know, Dr. Rossman, I think it's also important to emphasize that because this is voluntary, our prioritizations still require people to actually sign up for this. And so outreach efforts such as this and other outreach efforts that I know are going on, certainly in our health system and other places, to help prioritize people who are disproportionately affected, but maybe minorities and may have that skepticism. I know we just talked about that in the beginning, but I think that is also a challenge for us in order to actually get them to come and get the vaccine.
Oh, absolutely. And in the prior panelists, I thought did a fantastic job of, saying we've done amazing job of bringing these 2 vaccines to market, and they're here. They will do 0 if they sit in the freezers of our local health departments and our hospitals and our pharmacies. To be effective, they have to actually get into people. And that involves reaching out to people, finding people where they are, and providing the education. And I love Dr. Harbowski, right? The science behind these vaccines so that people can make the best educated decisions for them. So we have, I think, lots of work to do. And I'll be frank, I think as much as the United States has invested in bringing these 2 vaccines to market, it's unfortunate we haven't spent the same time, treasure on thinking about how he actually gets into people's arms.
Yes, it's definitely a challenge for us at this time. So shifting a little bit about the who in terms of who is giving the vaccine. Are the vaccines being administered by nurses or other qualified personnel? And how are they being trained or certified? And there was a question from a resident saying that they're a healthcare professional in the county and would like to volunteer to help vaccinate. Can qualified health professionals volunteer in this way? And then where would they go to find information about that?
Thank you. And awesome people wanting to help out. Everyone wants to give back. I mean, there's so many things that we can talk about sort of that haven't gone right, particularly in the past 24 hours, but there's so many positive things like people wanting to help out and vaccinate. If you would like to join our team, you can volunteer with the Medical Reserve Corps. And there's also COVID response team with the state of Maryland. Currently we're looking for all types of people, both professionals who are able to vaccinate based upon their license, as well as persons that are not healthcare workers, but we equally need them, perhaps if not more, to help us get through our clinics. So who is vaccinating? So in Maryland, there are licensed providers who are able to vaccinate nurses, who generally, I'm going to say, are the largest percentage of healthcare professionals who vaccinate. We have our doctors, our physicians. Pharmacists are able to vaccinate. And so I would say, by and large, if you're receiving a vaccine, it's probably going to be a nurse. It could be a doctor. It could be a pharmacist. Because this is such a monumental task to vaccinate all of Maryland, all of Howard County twice, we need to, the governor has allowed exceptions for other health professionals to be trained to vaccinate. So a veterinarian who we know gives shots and vaccinates our pets can give a vaccine as well. And we are able to train other persons to vaccinate, assuming they have passed the competency and skill set to do so. So many different ways. Everyone, at least in Howard County Health Department currently, who is vaccinating are very experienced vaccinators. Public health departments are accustomed to doing vaccination, both, I'm going to say routine vaccination of both children and adults, and certainly the annual flu vaccine. So we're very experienced in that.
Great. So shifting a little bit to 1C, and I just want to mention that 1C is adults 65 to 74, essential workers, and then phase 2, which will be the adults that are 60 and 64, and then additional patients that have comorbidities and other essential workers in this time frame. What do you think would be the time frame for getting to some of these other levels, based on what you're seeing from the supply that's coming and the rate? Or do you think that will change?
I wish I had a good answer, and I'm going to have to say I really don't know. Currently, vaccine is in very limited supply. I would hope that we are able to move beyond 1A at the end of January, and beyond that down the next tiers. But currently, because vaccine is coming in limited quantities, I still don't know what amount I will get next week, nor what vaccine. And what that tells me is just we just don't have a sufficient supply, and we're still working on 1A. So that is a challenge, and I know it is frustrating everyone. Everyone is frustrated that we can't vaccinate everyone straight away. But we are doing our best, again, to prioritize groups, as we've just discussed, and when the local health departments get the vaccine, to get it out as safely and efficiently as possible.
So I think one of the other questions, I'm sorry, go ahead.
No, that's okay.
I was going to say, one of the questions from the audience is, what is the definition of a comorbidity? And I think sometimes as physicians we'll speak about comorbidities, but I think maybe it's worth explaining to our audience what comorbidities actually means, and then whether or not a resident that has a comorbidity will need some sort of physician authorization to get a vaccine, or can they just come and get the vaccine?
That is a super question. We need to dig deeper into these definitions, because I know I get lots of questions from, what's the definition of a first responder? What's the definition, I'm not being facetious, of a healthcare worker? So certainly when we talk about comorbidities, and by comorbidities, it means illnesses or diseases that somebody has that affects their health. And in the prior panelists Dr. Hrabowski talked about his high blood pressure. That's a comorbidity. It was also mentioned cancer. And we could, one person's high blood pressure, that may be a really significant effect on their health, and another person's high blood pressure, not so much. Similar with cancer. So when we get to that point where we are vaccinating persons with comorbidities, I don't have an answer yet of exactly how we decide, is your diabetes worse than that person's asthma, than that person's hypertension? That's tough. And I don't know that we're going to have an answer for that. Will we require a doctor's note? I hope not. But again, I think we need to dig deeper into that. I'm hoping at that point there will be sufficient vaccine. We won't have to make these such tough ethical decisions of almost playing Solomon, right? Who guesses more than the next guy? And right now that's currently what's happening. and it's very difficult for everyone. I'm hoping that really vaccine continues to ramp up production of these 2 vaccines, that we will bring to market and authorization additional vaccines. So there will just be more and more in the coming months. And I'm really hoping by springtime that we're having a different discussion and we're vaccinating the entire population who wants it.
Yeah, that's a good point. Do you think there's a chance primary care physicians will be able to distribute the vaccine in the next few months?
That I do. So currently, if you are a provider, you can register with the state of Maryland through something called Immunet to say that you're interested in receiving a direct shipment of vaccine so you can vaccinate your own patients. Wouldn't that be nice? Because again, that would tell us we have sufficient supply of vaccine that we can distribute vaccine almost like we distribute other vaccines like shingle and all the childhood vaccines. So if you are a provider, you can reach out to the Maryland Department of Health by submitting information that you would, through Immunet, that you would like to receive direct shipments. And again, I think as soon as Maryland starts receiving more vaccine, that will happen. I didn't mention that if you listen to Dr. Balt's press conference this morning, he did a great job of describing how this vaccine sort of makes its way down into the arms. Well, the federal government is controlling all vaccine. Vaccine is then shipped to the states, and then the states distribute it to the hospitals, to the pharmacies, and to local health departments. So it is a fairly long process, and that takes a while, and why we don't always know what we're getting, because again, it's just going down through the process right now, and it's all being very tightly regulated to ensure that the vaccine gets where it should be, and it gets into the arms of the people that currently are eligible to receive it.
And I think, Dr. Rossman, the other thing that's worth mentioning to the audience is the specific requirements for these vaccines. It's not like having a flu shot in your office where you can just hold it and store it in the fridge and then give it to patients. There's specific temperatures, there's special freezers that we've been utilizing, certainly for, I know, the Pfizer vaccine. And then the logistics of us giving the vaccine is we are watching for reactions and we are monitoring people afterwards. And I think that makes it a little bit more challenging than simply, putting a shot in an arm and then moving someone on. And so I think those challenges are things that we're working on how to use all of these things and then efficiently get people shots. So I think that's very important to mention as well. So it isn't quite as simple as getting the vaccine and then just giving it to people. And I think your department and certainly our hospital have been working with these challenges, and it's a good thing that we're doing that, but it does limit our ability to give more shots if that is available.
This, I think Nikki mentioned this in the beginning, new. This is all new, and we are learning every day to do things better and adjusting. So yes, these 2 vaccines require freezer storage. The Pfizer ultra cold storage in a very special freezer. In public health, we're used to storing vaccine in special vaccine refrigerators. But again, the Pfizer is ultra cold. And yes, we had to buy 2 ginormous ultra cold freezers in addition to the freezer refrigerator that we have for the Moderna vaccine. So there is complexity in actually just storing it. The other aspect of it, once we open or thaw a vial, we have a certain amount of hours to actually vaccinate someone, or we need to dispose it, which we don't. So it means when we have a large clinic, we're not drawing up massive amounts of vaccine because we don't want to have to waste 1 drop of this precious asset at this time. As you mentioned, again, related to its newness, and Dr. Karen talked about this a little bit, there is reports of anaphylaxis or adverse effects occurring after vaccination. So it is required post-vaccination or after you get vaccinated to sit for a minimum of 15 minutes and be monitored. So we're not able, our throughput is less than what our throughput is for flu vaccine, where we can draw up vaccine in the morning, we can rapidly vaccinate people and off they go. In this case, it's a longer period of time.
Yeah, I think that's important. And I think as you talk about the 15 minutes of watching, can you comment on whether or not you've seen side effects, or certainly from the Howard County residents that have been receiving this, what are the side effects that they should anticipate on the vaccination? And then should residents who have other allergies take the vaccine?
Yeah, great questions. So there are side effects after vaccination. Some people will get them, some people not. Most of the side effects are related to where the vaccine was injected, which typically is into your arm. And many people report arm soreness. And I think Dr. Harbowski said he thinks he actually got the vaccine, the Moderna, because he and his wife's arm hurt afterwards. We'll see the next time we talk to him. And the arm soreness generally is not something that most people say, I can't go to work, but may be a little bothersome, and within 24 and certainly 48 hours goes away. Other people may report being fatigued or tired, and a few people actually report fever. And again, I would agree with Dr. Karen that these side effects are worth, what, my light just, I would say that the soreness and the side effects certainly is minimal compared to the benefit of this vaccine, of both vaccines. Both vaccines require 2 doses. I don't know if I mentioned that. And it is reported that the side effects of the vaccine after the second dose may be a little bit more. What I think about that is that means the vaccine is working. So just like Dr. Harbowski seemed excited that his arm hurt, I think that too. That says, oh, my body's reacting the way it should react so it can fight the COVID virus if I get it. Worrisome, right? The anaphylaxis, or when people have difficulty breathing immediately after getting one of these vaccines. That is a known reaction to vaccines in general, and all professionals who administer vaccines are aware of that and know how to respond to it with medication, with the appropriate medications. In the health department, we do have EMS on site should someone have a serious reaction, and all of our vaccinators are trained to identify someone having a problem and also to treat that as well. The persons with, I'm going to call them food allergies or environmental allergies, they can still get the vaccine. They should bring their EpiPens with them if they want, but again, all sites would have the medication needed. And the only contraindication or reason not to get this vaccine is if you have anaphylaxis or a reaction to one of the components of the vaccine, which is kind of funny, right? How would I know that unless I got the vaccine? And I'll tell you a little story, and maybe, I don't know if it makes people feel better. I have my daughter, she's a healthcare worker in another state. She has a history of very significant and severe anaphylaxis to certain foods, and has, I think once or twice, wound up in the hospital. She elected to receive the Pfizer vaccine when it became available to her, because to her, that will enable her to take care of her patients and go to work and have less anxiety than worrying about if she has the disease. And she did well, no problems, and looking forward to her second dose.
Great. Well, that's good to hear. So I'm pivoting a little bit. We have a few minutes left, and I want to ask some simpler questions just because I think our audience was asking these questions. In order to get the vaccination, does immigration status matter?
No. Howard County Health Department serves anyone in our community regardless of immunization status, and you will not be asked about that.
Is there a cost to the vaccine?
Vaccine is provided free right now. We're not even asking for insurance information. However, in the future, with other providers, I don't know, someone may ask for insurance information and insurance may be billed. However, it should be of no cost to the individual.
That's good. And I think that's really important given the economic consequences of COVID. We don't want to dissuade anybody from going to seek a vaccination because of economic or immigration status type issues. That's very important. Now, how about if I've had COVID before? Should I still get the vaccine?
So what the scientists tell us is that we don't know how long immunity lasts after you've had COVID disease. And we don't really know how long the immunity will last with vaccine, but we're hopeful, as the previous panelists talked about. So if you've had COVID, you are eligible for vaccination once you are well and out of isolation. We don't recommend vaccinating anyone really with any vaccine while you're sick because you may not have a great immune response. So you should certainly wait until you are well and functioning normally to be vaccinated. We do think that natural immunity lasts up to 90 days. So there are some individuals that may want to wait until 90 days, but I would suggest as soon as you can get vaccine, get vaccine.
Good. So I'm going to wrap up with one last question for you. And I think we need to be patient and we have to be a little realistic about when we're going to get the COVID vaccine. And this will take a while. Clearly, we don't have all the answers. And I think it's a matter of time and that information changes. But one thing that's going on right now in the community, and I think nationally, is COVID fatigue. And I was wondering if you have any tips, and I'm certainly happy to share some tips with people experiencing this and how we need to be patient.
Oh gosh, aren't we all sick of this? I can tell you when we received vaccine December 31st, everyone in the health department gave a roar because we see a loud clap, a thunder, energized because we see this as the beginning of the end to get us back to our normalcy. But until that time, we have to continue wearing our masks because of the transmission risks that we don't know. We need to continue social distancing and washing our hands and being kind to each other because this is really, really hard. And it will take months to get us to the point where we can begin to return to what we used to do before COVID. So, yep, we all have to be patient. We have to dig deep. We need to care about each other and support each other. So when one person is feeling low, we're going to help them and bring them back up. And we're a great community in Howard County. And I know we will do that. We have been doing that. We just have to hang in a little bit longer.
I agree. And I think certainly from the hospital standpoint, when we see the second surge and we see the number of patients that are here, we realize that a lot of these illnesses are because it's transmitting in the community and people are maybe letting their guard down. And I think that's a challenge. And it is a sober reminder when we come to the hospital of what's actually happening if people do let their guard down. And although COVID fatigue is tough, as you've mentioned before, having COVID is even worse. And having your family members get sick is even worse. And so it's, continual public health message from myself, and I'm sure Dr. Rossman would say the same things: wearing a mask, washing your hands, social distancing, making sure that you don't mix bubbles if you have them. And certainly when we see holidays, we see the uptick. And it's very painful to see that, is that people will feel that they are able to take a break or enjoying themselves, yet putting themselves or potentially somebody else in danger. And so I think that is a tough message, but it's a reality that we live with. And if we can get through, like Dr. Rossman said, this is beginning to see the beginning of the end and the light at the end of the tunnel, but we do still have to get through this period of getting people vaccinations. So please, I would encourage all of you to follow all those regulations or guidelines rather, to make sure that we continue to stay safe and take care of each other. So Dr. Rossman, I really deeply appreciate for having this great conversation with us about the COVID-19 vaccine and distribution. We know more information will be coming out, and we know that the health department will continue to educate our residents about more information as it becomes known. So thank you very much for all of your time tonight.
Thank you, and thank you for having me.
Great. So in closing, we know that we have not been able to answer every single question tonight. And I realize that many of you have very specific questions that you would like answered, and I'm sure that you can receive answers for them from your healthcare professional or other resources like that. This is one of many ways to get more information about the vaccines. And some of the useful sites include the Howard County Government and Howard County Health Department, the Maryland Department of Health, the Center for Disease Control, and Johns Hopkins University and Medicine Coronavirus Resource Center. The Howard County Health Department, the Horizon Foundation, and Howard County General Hospital will continue to provide information to our community about COVID-19 vaccines. As Nikki mentioned earlier, we encourage you to keep in touch with these organizations by following them on social media, and you can bookmark the county's Stay COVID Safe website for up-to-date information. As I mentioned before, please continue to wear a mask, wash hands frequently, avoid congregating in large settings, and practice physical distancing. Our community is strong and resilient. We will get through this pandemic. And finally, I want to end our conversation tonight by thanking everyone in our community who has been fighting this disease, from the county government, the staff at the health department, to our first responders, particularly EMS, to healthcare staff and nursing facilities, and our amazing staff at Howard County General Hospital, and many, many other healthcare providers in the community that have been helping with this. And to those that we have lost, we continue to grieve for them and their families. We hope that the vaccine is that light at the end of the tunnel, and I look forward to recovering from this horrible disease in the near future. And one last reminder, please submit any questions that you still have to info@thehorizonfoundation.org. Thank you very much for joining us tonight, and have a great evening.